Welcome back. You're watching Morning Express, and this Wednesday we do talk health every Wednesday. But this time around we're talking about facial distortion model. It's a form of chiropractic. If you've heard chiropractic, but if you haven't heard it, Dr. Hamisi Ali is in studio to help us understand what this is all about. For people who don't understand, for Kenyans who don't understand, or anyone who is watching, what is chiropractic?
Chiropractic is a medical practice whereby patients are treated using hands. So you use your hands to analyze the spine. There's a belief in chiropractic that most of the ailments that people suffer from can be related back to the spine. And if your spine is made to function properly, then there will be no interference with how the nerves emerge from the spinal cord to various parts of the body. And maintaining that state of health, then in chiropractic we believe helps people stay well and stay out of pain and other ailments as well.
All right, so there is facial distortion model that is a part of chiropractic. What is that about? Is it about putting people's neck bones in shape? What is it about?
No. Facial distortion model was started by Dr. Tapados, Stephen Tapados. Dr. Stephen Tapados was a medical doctor and an osteopath, an American osteopath. He was working in A&E, or accident and emergency units, and realized that a lot of medical problems that people suffer from, for example, you come in with a sprained ankle, you come in with a knee, people had gestures that they were using to explain what their problem is. And having been frustrated by the outcome he was getting by either medication or surgery, he wanted to look for a different perspective. Therefore, he came up with facial distortion model, which is, in definition, an anatomical perspective in which all etiology or all causes of musculoskeletal injury and other neurological and medical conditions can be considered to be as a result of 1 or 6 specific pathological alterations of body connective tissue.
All right, and that all has to do with facial distortion.
That's right.
All right, we're going to have a conversation on that just shortly, but let's understand what facial distortion model is all about. Dr. Lucas Trimmel, an Australian doctor, is in Kenya, and he's training physiotherapists on chiropractic, and so many other chiropractors in the country today are benefiting from his training of physiotherapists. And let's hear what exactly this practice is all about. What is it we do not understand? Maybe we know about it, but we do not know much about it. Let's learn a few lessons, and then we'll come talk to Dr. Hamisi Ali in studio.
So I'm a medical doctor. I'm also an osteopath. But what I now do, FDM, facial distortion model, is completely different because we have different diagnoses. So I don't treat a patient's osteoarthritis. I treat a facial alteration. So I treat a facial distortion, and I don't treat osteoarthritis. FDM is the facial distortion model. You know, if a patient comes to see me, comes to my office, and he has certain complaints in the musculoskeletal system, I first of all ask him where the problem is. And then I will watch him, and he will show a certain body language and a certain pain gesture. For example, a patient coming with wrist problems. For me, it makes a difference if the patient shows me, I have wrist problems like this. Or maybe he shows me like, I have wrist problems. Or maybe he says, I have a wrist problem. So I see different pain gestures and different body languages. And in FDM, we believe that the patient knows a lot about his problems, subconscious. So we have to bring it up to the surface, and the pain gesture and the body language helps us. And depending on the pain gesture and on the body language, we divide all musculoskeletal problems into 6 different patterns, 6 different possibilities, 6 different diagnoses. And these diagnoses, they are considered to be 6 different alterations of the fascia. So we call it fascia distortion. So, and if I know which distortion it is, I got my diagnosis and I can treat the patient. I treat the patient with my hands, mainly with my thumb, to correct these alterations of the fascia. Within just one technique, the patients improve a lot, and it's a very effective technique.
Today, I came in because my back never seems to want to completely release, specifically in some areas of my trapezius muscle back here, and just my neck, and all the way down to my hips. So when I came in today, I had tightness, I had pain here, and I had pain down here. Now it's gone, and I'm just really delighted. What I really like is the philosophy, that they're not just going to crack your back, but they've also given me exercises.
So there are three things I have to know. First, I have to watch the patient while he's telling me about his problems, because then I see the body language. This is first. Second, it makes a difference how the problems occur. Was it an injury, or did it develop just gradually, or how did it come? So the patient's history is a very important factor for me. And third, I do certain examinations. I test some movements, I test some functional things like jumping, running, walking, wherever the patient has the problem. And out of these three things I can come to my diagnosis. Only 6 diagnoses, and every patient coming in has one or more of these 6 diagnoses, because we only know 6 alterations of the fascia. There are different types of fascia in the body, like a banded one or a circular one or the folded one. Different types of fascia, different types of connective tissue. And we have, for example, our first alteration, our first distortion, we call trigger band. It's if fibers are not parallel anymore in a banded fascia, if they get twisted or if they get, fibers get separated, then we call it a distortion. This is our first distortion we know, our first diagnosis. It's called trigger band. And if we do the treatment, we have to correct these fibers. We have to bring them together, untwist it, and put all fibers together that they look like proper again.
I've had back pain for about 30 years and gone to different therapies and tried to get help, and I'm here today because a specialist was here and he really has helped me. I came in with hip pain and neck pain and just tightness, and he's really helped me to be loose. I don't have any pain right now.
We use our hands and we talk to the patient. We don't use X-rays or MRIs or ultrasound because it doesn't help us to get the diagnosis. So maybe this is a big difference to school medicine. We don't do any blood tests or any other expensive examinations. It's not necessary for musculoskeletal problems. It's not necessary. So it's a cheaper way to come to the diagnosis, and a more quick way and easier way. If I think about my patients, for example, with neck problems, every patient with a neck problem gets an X-ray, for example, but then he gets the same therapy as without an X-ray. So it doesn't make sense. I mean, you need an X-ray or an MRI, for example, to exclude that it's cancer or something else. But for the musculoskeletal problems and disorders, you don't need it. And in FDM, you have far better tools. You have your eyes, you have your hands, and you have the patient. The patient will tell you. The patient subconsciously knows everything. You just have to bring it to the surface.
They really do much more of like a physical therapy kind of manipulation of your muscles rather than crack your bones. And I've been really pleased with that because I've seen continual improvement. And they explained to me some of my issues, which was sitting at a computer too much, doing this, which all of these muscles begin to collapse. The back stretches too much, and then it's all connected. Well, they've been working on those muscles now for maybe 6 weeks, and I can tell I'm sleeping better than I ever have.
The biggest critic might be that what we are doing is not evidence-based medicine, but you have to consider that many things we do in school medicine, which work, are even not evidence-based. But I don't care about evidence-based medicine. I care about my patients. And if I see that they are far better after the treatment, I don't care about evidence-based medicine. I only know why they criticize FDM, because they don't know it. They have never tried, they have never been a patient, so they criticize. But I know many other medical doctors who were patient, for example, in my office or in any other office, and who got a FDM treatment, and they completely changed their mind. They started learning it, they're attending seminars, and they want to do it themselves. Stephen Tupaldos is only one person, and he was the inventor and the founder, originator of FDM. And he published first in 1992, and then unfortunately he died in 2005. So one person. And nowadays we have, for example, in Europe, we have more than 1,000 therapists doing FDM. So it's still not widespread, but it's more known than 10 years before. And we have therapists, and many therapists in Germany, in Austria, in Italy, in Poland, in the States, in Japan. We have therapists in Burkina Faso, that's the first country in Africa. And now maybe, after holding a seminar here, we have some therapists in Kenya as well. And so I think patient will tell other patients. A patient who got a FDM treatment and feels better will tell his neighbor, his father, his son, his wife, his friends that it helped. So many more patients will get FDM treatment.
And that is chiropractic, one of the forms in chiropractic, I guess, that is FDM, or what people call facial distortion model. And in studio to help us understand this is Dr. Hamisi Kote Ali, and he is a chiropractor. Thank you so much for joining us.
Thank you.
A lot has been said about chiropractic and FDM, or facial distortion model, but then again, people tend to shy away from it, thinking it's not exactly that evidence-based sort of medicine. And that is what people go for. You know, they go to hospital because they have a fever, and then they're given medicine. They either have to take it in form of a syrup or in form of tablets. But this one is a different form of medicine. So how different is it from what we're used to as human beings?
Let me start by an explanation. There is a lot of misunderstanding in the general public and also in the medical fraternity about, first of all, chiropractic. Everywhere you go, most people either don't know about chiropractic, and those who know it negatively. Not because chiropractic is negative, but because there are people who spread negative views about chiropractic when themselves don't know anything about it. Then we also have another group of people who would go out and talk bad about chiropractic because they either went to see somebody who called themselves a chiropractor and they are not trained as chiropractors. So those are some of the setbacks that chiropractic have been experiencing. When you go to the medical doctors, I can assure you, even in this country, very few doctors understand what chiropractic is. They all think it's popping bones back and forth. That is not chiropractic. You know?
That's what I thought.
Yes, that is not chiropractic. Chiropractic, if I may say, is that chiropractic and medical and main medicine in terms of schooling is the same. If you go to Stanford University, for example, medical school, and you compare their education with chiropractic college in terms of what is the pre-requirement entry requirements to get into chiropractic school and what they cover between year one and graduation, it's the same. It's the same number of requirements, it's the same number of subjects and amount of hours and practical hours required to become a chiropractor. Now, then we go to evidence-based. Research, there's a lot of research. If we just go to research and decided to go about research, is that 17% of all medical procedures carried out in whatever medical practice you want to call it, hospitals, name it, that's the only evidence-based. The rest, 83% is not evidence-based.
Yeah.
So if we are looking at evidence-based, then a lot of the things that are done in hospitals are not evidence-based.
All right. So, in other words, you're saying that even the traditional healers, so-called herbalists, are right in whatever evidence that they have, that they've managed to get that cures whatever ailments.
Absolutely, because what is the aim of medicine? The aim of medicine is to treat. And as a doctor, what is your aim? Your doctor is supposed to be a teacher. You're supposed to be able to educate your clients and your patients with what's wrong with them and what you can do to help them. And that's why now when you look at fascial distortion model, which, first of all, let me correct you, is not a chiropractic, is not a specific chiropractic treatment. Fascial distortion model is a treatment that can be offered by the following group of people: medical doctors, osteopath, chiropractors, and physical therapists. Those are the professions licensed and allowed to practice chiropractic. So when you look at fascial distortion model, you look at it as a different view. It's a different perspective. It's a different way of looking at things, whereby a patient comes to see me, and when you look at patients across the globe, patients will come and give different pain gestures and different body languages. These body languages explain exactly what is wrong with the patient. But for me as a practitioner to be able to come up with a diagnosis, I need to consider three things. One, I need to consider the patient's history. What happened? How did this start? Number two, I need to be observant and watch for the pain gestures and body language as the patient is explaining what's wrong with them. And then I need to do objective findings. In the objective finding, we do functional testing and neurological and orthopedic testing. Here, what are you looking for? You're looking for pressure pain, you're looking for reduced joint range of motion, you're looking at reduced strength, you're looking at joint fixations. All these, when you compile it together, then you come up with a diagnosis. And the other interesting thing about FDM is that in FDM, you don't need expensive imaging to be able to diagnose a patient. However, when you listen to your patient and you're going through this diagnosis process, you should be able to rule out any serious pathologies like cancer or infection.
All right. So at some point, you know, people will go to, say, a chiropractor, or in this case, a physiotherapist, and say, you know, I'm having neck pain, I'm having back pain, and I'm having whatever pains that they have. How are you able to determine what exactly ails them with those symptoms?
With FDM, actually, I don't know what's wrong with the patient. The patient tells me what's wrong with them. So I'll listen to you. When you come to me, I'll listen to you. And I'm also looking at what signs are you giving. Some people will be like, oh, my pain moves like this, or I have pain like this, or I have pain here, or I have pain in a specific spot, or I have pain like this. And all these pain gestures have something in common that tells me what's wrong with them according to the 6 specific fascial distortion alterations that can happen in the fascia.
So what sort of treatment is given after the symptoms have been identified?
It all depends on what you show me. For example, if a patient comes and shows me a line, so something we call a trigger band, then I'll perform some tests to see is it a true trigger band or is it another fascial distortion, a different fascial distortion. And once I'm sure is a true trigger band, then I'll use my thumb to be able to correct the distortion. And what is interesting about fascial distortion is that after the correction, you either get 100% release or 80-90% relief from the patient.
All right, which is an alternative as well to what people are used to on a daily basis. All right, so you're one of Kenya's top chiropractors, and maybe there's so many patients you've dealt with on a one-on-one basis, but can you easily tell what ails a patient by just looking at their hands?
No, you can't just look at the hands. You need to look at the pain gestures. You need to look at the patient. You need to listen to the patient history because the patient knows what's wrong with them. It's just that most of the time it's subconscious. They can't verbally say it. But if you listen to them and then help bring it out through understanding what different gestures tell you, then it's very easy to fix a patient. And with fascial distortion, actually the patient guides you. As you're treating them, the patient guides you into what track of their body to follow as you fix it.
All right. Have you received emergency cases as a chiropractor, and have you been able to deal or heal those patients?
What do you mean by emergency?
Emergency, maybe someone is having a heart problem, and then they come to you and say, you know, I've been having some sort of difficulty in breathing. How do you deal with that situation if it gets worse?
I've had a case of a patient who came in with a worst, they complained of a headache worst that they have ever had before. And when you do the basic vital signs and stuff, we realized the patient was about to get a stroke. And in that case, that is not my realm. That is the realm of a medical doctor. So what we do in such a case, we call for an ambulance, and the patient is taken to the hospital. So you need to be able to rule out, as I said, serious pathologies, and you need to be able to know where to refer such patients.
Okay, and does it get to a point where you say, you know, yes, I can't handle this, and I think now we need to call in an ambulance, or does it get to a point where you say, I think this we can take care of, and after 1, 2, 3 visits, you're going to be perfectly well, 100% fine?
Absolutely.
Yeah.
When a patient gets off my treatment table, I can tell 100% whether I can fix it or not. And when I can't fix it, I definitely advise the patient to go to the right direction. All
right. How many visits does someone have to make to you before you can declare them fully healed?
This depends on 2 things. One is how long has that problem been? The longer the problem has been, it may require more treatments. And mostly you're looking at between 1 and 6, or even for a long-standing case.
Visits, yeah?
Yes. For an acute case, it's 1 and 3.
1 and 3
visits.
All right. Well, some people would actually think maybe these are all just money-making ventures, you know, in the health sector that we are looking at, and maybe they tend to underestimate what other forms of healing or cure they can get from, say, chiropractic, for instance. Do you think that maybe we do not know? It's the lack of awareness that is leading to so many deaths in the country today.
Actually, there are several researches. There's several research, and yesterday there was an article on one of the daily papers that show that in today more people are taking a lot of more painkillers and or pain medication than we have done in history. So people needs to understand that there are so many other help that you can get out there, and you don't have a deficiency of painkiller. There are so many pain conditions, especially musculoskeletal pain conditions, that are occurring today because of poor sitting postures in offices, standing too long, sitting in one position for too long, static positions, that end up causing a lot of the problems that people suffer from. I was once listening into people who work in call centers, for example, like Safaricom or Airtel, and you have people complaining of ringing ears. And they go to every ENT you can think of, and they can't find a solution to it because it's not a pathology. It's not a medical condition. What it is, it's a biomechanical anomaly. And what you need to do is you need to correct the biomechanical problem, and not.
So even when you have turbulence in your ears and it's constant, you think that can be fixed by FDM?
Absolutely.
Yeah.
Yes.
All right. And going forward, what advice would you give to patients out there who maybe would like to know more about your services, but then they do not know where exactly to go? Because, for instance, I wouldn't know where to find you in case I needed chiropractic, attention.
First of all, I would say that we have been the first people to bring, actually I have been the one to bring Dr. Tremel with the help of the European Association of Facial Distortion Model to Kenya. And we have been able to train in the first module 24 therapists.
Yeah.
So we have 24 therapists in the country. Unfortunately, maybe almost all of them are in Nairobi, but we have 2 in Nakuru and 1 in Mombasa. For my office, I'm located in Parklands on Kusi Lane, and my phone number is 0713-030-395 or 7. Or you can look us up in our Nairobi or Mombasa or Nakuru office, whereby again you'll be able to get the exact same service that you can get in Nairobi.
All right. So to people out there who maybe are over-reliant on medication, painkillers are the easiest thing they can come by, antihistamines are the easiest thing they can come by. You think that maybe they are grave side effects? And if they, of course they are, but can they be healed or cured by your practice? Say people who are addicted to painkillers, can they be cured by your practice?
Yes.
Yeah.
You realize that a lot of people who live with chronic pain today don't live in chronic pain because they want to. It's because they have gone to their medical doctor and they have been doing what their medical doctor has told them to do. But when you look at medical practice, what happens is that you go to a medical doctor and you put him in a fix, because the moment a medical doctor cannot give you a pill that will solve your problem, he'll either send you to therapy, and if he doesn't send you to therapy, he'll send you to have an injection, a steroid injection, or have surgery. But these are not treatments that will be able to solve biomechanical conditions. In this case, most of the skeletal conditions that affect our human body.
All right. Well, Dr. Hamisi Kote Ali, thank you so much for joining us on this edition of Morning Express. And with that, we now wrap it up. In case you're having body pain, how do you sit? I don't think this posture I'm seated in is the best posture I should be sitting in, because I can almost feel my upper back having a bit of strain. But that is part of the reason you might need to see a chiropractor. And, well, thank you so much for coming.
Thanks so much for inviting me.
And, Sharon, have you been to a chiropractor? Or
I was actually just trying to catch up with the interview. It sounds like it's not
is.
really.
It's actually pretty interesting. It's about, you know, sometimes you will have back pain, neck pain, maybe head pain sometimes. And you think painkillers are going to do it, but it's not exactly painkillers that are going to heal you. It's someone like him, a chiropractor.
So it's some sort of physiotherapy?
It's some sort of, he would be the best person.
I think I will need to make time to
well,
to find out
physiotherapy, yes, because the physiotherapists actually do pay attention to patients like those, but chiropractors are the best people to treat it for that.
Fantastic. I'm going to have to make time for that.
Yes, you should. What do you have for us in one
So today we have, of course, a lot of global news, but it's important to note that Nigeria military is saying now that they have managed, to kill a number of Boko Haram, militants. So, and also from North Korea testing some missiles, and of course sending the entire globe into another sort of frenzy. So some of the highlights that we have today on Worldview.
Well, do tune in to that conversation with Sharon Momanyi on Worldview and get to know what's making headlines around the country. That is on KTN News, which you can access on channel 14 on Zuku, channel 274 on DSTV, and as well as online, ktnnews.com. You can stream us live. My name is Joy Doreen Bira. I'm out of here. Worldview coming up next.